Good morning. My name is David Campos. I'm a Deputy County Executive and Lead Public Information Officer for the County of Santa Clara's Emergency Operations Center. Today, we are going to have a briefing from the Santa Clara County Public Health Officer, Dr. Sara Cody, who will be making some brief statements, and then we will be happy to take questions. And to the Spanish language media, we will be available to answer questions after the main press conference. So with that, let me introduce Dr. Sara Cody.
Good morning, everyone. It's good to be with you, good to be back here. Thank you for standing as far back as you are because I do have my mask off. I haven't seen you all in a while, and I just wanted to give you an update as to where we are with COVID-19 here in our county. And we've brought some pictures to try to make a point. So I'm going to step over here and just project a little bit to tell you where we are. So, and actually, can I take this with me? Will that help? No. Oh. If I project, will this work? You know what I'm going to do?
You can move this graphics behind you, got closer to the mic.
Okay. It's going to take it.
Okay. Will this work?
Yes.
Great. So this is where we are in the epidemic locally in Santa Clara County, and I wanted to just highlight a few things. So remember, this is way back in March of 2020. And right there in mid-March is where we put shelter in place into effect. And we saw here by May, we were down to very low numbers of cases reported each day. On some of these days, we had just one case reported in the entire county. And then, as you'll remember, after a period of really low case counts, in early June, we began gradually easing restrictions and reopening, as did other counties around us. And what we saw was first a gradual increase that really began to accelerate in late June and right up here through mid-July. So I want to tell you a little bit about this acceleration as well as what this red part means. So here when we opened, I think it was not just that more people were out and about in businesses that we'd reopened, but I think that people got a sense that because things were open, that it was safe, right? But the truth is that COVID-19 is still circulating widely in our community and circulating silently, person to person to person, until then it shows up in someone who becomes very sick and lands in the hospital. So I think that's probably what was happening. As far as who are these folks, who is more likely to be getting infected than others, we're seeing a couple of trends here. They are also seen in other areas, and that is one, people who are younger, under the age of 35, rates are increasing much faster in that group. Similarly, rates are increasing much faster among the Latinx community. That's true in our county, and it's true in surrounding counties as well. Here you can see in mid-July, it looks like, oh, maybe things are getting better. Maybe miraculously something happened. But the truth is, in this red area, we just don't know. Because the state CalReady system, all of the laboratory reports go into a state system and then are reported to each county. They're having some technical issues. They've gone back maybe as far as mid-July. And so this, we just don't know. We don't know if our cases are rising, plateauing, or decreasing. And so we are very anxious for this issue to get resolved. We expect that all of these numbers are going to go up. To what extent, we don't know. So the data that we do know more about, I'm going to show you this. This shows, this is all of the hospitalizations across all of the hospitals in our county, and you can see it over time. This is a shorter time period. This is just the beginning of July until now. And what you can see is that in the first few weeks of July, the hospitalizations were increasing. And then in the last week or so, they have plateaued. So they've kind of stabilized. The last report we had, 169 people with COVID-19 in the hospital. Those are the blue bars. In the red bars, sort of superimposed on top, those numbers represent new patients with COVID-19 hospitalized on each day. You can see that that jumps around a bit, but in the last couple weeks, here this red line has sort of been coming down. So while we, again, can't interpret what our last few weeks of data mean as far as the cases, the last few week or two of hospitalization data is somewhat reassuring that things are leveling off, but it's not enough to really know. So, whoops. That may fall down. I just wanted to leave our community with a few messages. Number one, COVID is still here. It is still very much a threat, and it's circulating widely in our community. And each of us still needs to do everything that we can to bring it under control. There's a lot that we don't know about the virus, but there's a lot that we do know. And one of the most important things that we can do is to always wear a face covering. If you walk outside of your home without your face covering on, it should feel weird. It shouldn't feel right. It should feel like being in a car without a seatbelt. You must wear your face coverings anytime you're outside your home. Number two, whenever possible, outside is better than inside. We know that this virus is spread both by droplets as well as aerosols. When you're outside, you're much safer. The people around you are much safer. So if you combine wearing a face covering with being outside, with keeping a distance, then you will keep those around you safe, and the people that you're with will keep you safe. The second thing I wanted to emphasize, and this is a very human reaction, we all feel a bit safer with people that we know. We feel safer with our family. We feel safer with our friend. But COVID-19 doesn't really care. And so you're not actually safer just because you were the family member or just because you were a friend. And we all have a very human tendency to move physically closer to people that we're comfortable with. But that's how COVID spreads from person to person. So even if you're at an outdoor gathering with family and friends in a small group, everyone needs to be outdoors, needs to be at least 6 feet away, and needs to be wearing a face covering. That's enormously important. So we're going to be at this for a while. And as we've been talking about over the last month, the key is really risk reduction. What can each of us do every day, every time we go out, to reduce the chance that COVID will spread from one person to another? Thank you, and I'm happy to answer any questions.
Can you talk about where the data problem is and how, at this critical time, how inconvenient that is for you?
Right. So just as we had back in February and March, when we didn't have enough testing, we felt blind. I would say that right now we're back to feeling blind. We don't know how the epidemic is trending. So it's not just inconvenient, but this lack of data doesn't allow us to know where the epidemic is heading, how fast it's growing, or not. The problem seems to be with the sort of juncture between electronic laboratory reports coming in and the routing. They're not getting routed the way they need to be into the CalReady system. Apparently, the state is still working on a diagnosis. The diagnosis is not yet clear, and that's about all I know. I will say that our county has offered to help in any way that we can. And so we're actually looking to see whether we have some expertise here that we might lend. Of course, everyone statewide is very anxious to get this fixed.
We'll take a couple more. Yes.
Just a quick follow-up to his, when you say expertise, that means perhaps some tech help because we have so much of that here. And also, I was just curious if there was any new news on the Costco situation. I know they have done some testing, I believe, up in Mountain View. Is any testing planned for employees in perhaps San Jose and Gilroy?
I don't have any particular updates on Costco, but what I will say is that we have a team within our special investigations group that investigates work sites. And I want to highlight a couple of things that are important, and that is, in many cases, at a large work site, such as a Costco, you're inevitably going to see cases because the people that work at the Costco live in the community where COVID is circulating. So the fact that a large company like Costco has cases may mean only that they're large, and probability alone would dictate that they're going to have workers with cases, or it may indicate that there's spread in the workplace. So that's a really important distinction to know, and I don't have any particular updates on the Costco situation.
As far as things that are time, might we offer some tech help from companies that can help the state?
Right, we're trying to understand exactly what kind of help they need, and then we're reaching out both internally with the expertise we have in the county, as well as with colleagues in the valley.
Dr. Cody, if the new numbers from the state come out, as you suspect, perhaps higher than what we have now, what could change? Or what sort of new protocols would have to be implemented to cope with that, if anything?
Right. Well, in some ways, we would keep doing many of the things that we're doing, which is particular outreach and work with communities, both in Gilroy and in East San Jose, where we have some of the highest rates. We also, of course, need to stay with your help, increasing education with everyone. It's to keep up the work that everyone has already done. And to assist everyone in shifting their mindset to a long game, right? We have to be changing our behavior for a very, very long time. If we see that the cases are rising and they're rising fast, then we may need to put more stricter controls into place, as we did back in March, to really turn it down.
Over here.
Hi, Dr. Cody. A two-part question for you. There are some concerns about testing and the time it takes for some of the results to come back. More specifically, we're hearing from folks, some of the Verily sites, they're not getting results for 2 weeks at a time. If you could provide your thoughts on that, any concerns there? And secondly, as we're seeing more people out and about and cases jump among some of our more vulnerable communities, do you anticipate issuing some sort of recommendation regarding masks to be worn inside homes, some homes where there may be multi-generational families living within that home?
So as far as testing, we too are hearing and documenting that there are lengthening turnaround times. The turnaround times varies quite dramatically by lab. Some labs are still getting a turnaround time of 24 to 48 hours, and some are taking well over a week. So there's a lot of variation. And as everyone knows, a turnaround time of a week or more doesn't really help the person being tested because they don't know their status. And at that point, our ability to make a difference with case investigation and contact tracing has really evaporated. So shortening the turnaround time is incredibly important. Different labs are having different challenges and have different reasons why their turnaround times have lengthened. As far as mask wearing, there is not a particular way, of course, to enforce mask wearing inside someone's home. But if there is for example, a family or a multi-generational household, anything that household can do to protect the more vulnerable members, either a separate room, or mask wearing by members of the family, for example, that might be out of the house more, doing essential work, that would add protection for vulnerable family members.
Yeah, hi, Dr. Cody, asking for my colleague Kenny Choi, who's looking in remotely today. 2 days ago, new waiver guidelines released by the state. 3 weeks ago, you strongly encouraged elementary schools to look into this process. What's the message now to schools that are interested? What's the update on how many have initiated the process? How many schools, private versus public?
So the state did provide a way for schools within a county on a monitoring list to apply for a waiver to enable in-person education for elementary schools. And that's something that we in the county were very encouraged by. As you may know, the data regarding COVID transmission in children is still a little bit on the scant side. There were a number of early studies that were suggesting that children were less likely to spread to each other and less likely to spread to adults. And that was the reason why the state put this waiver process into effect. Subsequently, there's been a few other studies, small, that suggest that maybe children spread more than the earlier studies suggested. And so, we are still encouraging elementary schools that can put safeguards into place to look into the waiver process, and we are actively working with them. I don't have an exact number on the number of applications, but it certainly skews heavily towards private schools. There's not that many public schools that have applied and expressed interest in a waiver at this point. I want to make one more point about schools and about this epidemic curve. The best way that we as a community can get our children back into school for in-person learning is to crush the curve again. That is the best way that we can get our kids back to school. Because when there's widespread transmission in the community, teachers don't feel safe, parents don't feel safe, staff don't feel safe, and whether there is safe or isn't safe, it matters a lot about how the community feels. And when we're back, as we were in May, with very, very low case counts, and we'd really suppressed the transmission, people felt safer, it was safer, and that's the way we can get our kids back to school, and that's what we want to do.
Take one more question. Okay,
Dr. Cody, if you could talk about the state, the issues with the state. What kind of response are you hearing from the state? Have they told you as to when they expect to remedy the error? Just give us your insight on that.
So my understanding is right now the state is still working on a diagnosis. And because they don't have a diagnosis to the problem, they don't yet have a timeline as to when the problem will be resolved.